As I welcome everyone to watch this video, I would like to start the message on a biblical reference saying all of these, like new diseases like plague, leprosy, were advanced patrols of a great army that is preparing way out of sight. This biblical statement was being referred to those 39 diseases at that point in time, and where the communicable diseases started killing people. Scientists like Joshua Lederberg, who won the Nobel Prize at the age of 33 for his work in microbial genetics, did not think this statement as a mere rhetoric. And he won the Nobel Prize, and he went on to making a very significant impact by saying, "The single biggest threat to man's continued dominance on the planet, apart from man, is the virus." This was a statement which he made during his Nobel lecture. I was watching this film called The Great Gatsby, made in 2013, and there where this girl, a lady, Fergie, was singing this song, "A Little Party Never Killed Nobody." And the name of the song is also called All We Got. I was wondering about this baby doll and the party in Lucknow, where perhaps no one died from the party, but all they got was definitely one was singularly COVID positive. So, and similarly, we had Nizamuddin Muqtaz, which had a lot of COVID positive, as well as people are dying from it. So it's not that what was sung in 2013 still holds good. Nevertheless, with Corona, a lot of things have changed. Trade and travel, time, everything has been affected. Markets and mines have crashed, rallied, collapsed again. Now we are again waiting to see whether the lockdown will open. If it opens, then again, what a huge calamity. What a roaring, surge of people having been affected will be seen later. So a lot of speculations in the mind. But what I'm supposed to do is to talk about literature regarding diabetes and corona, and I'll come straight into it. I'll say that all the illnesses, wherever you have any illness, this will increase insulin resistance and raise blood sugar. And in this kind of a COVID-19, which is just a 3-month-old baby, and it doesn't know what it actually augurs, how ruthlessly ominous it is, or perhaps it is just there to be there for some time and then come back every year like influenza, measles, malaria. We don't know anything about it, but yet we all have to behave like experts and give our comments. So I have been given a chance. But why I will clearly state some facts is that the infection rates between type 1 and type 2, we don't know the difference. We don't know the difference between the A1C less than 7 and A1C more than 10, whether there is a difference in the patient's outcome. But all we know is that COVID-19 with comorbidities and elderly frailty, these effects, whether it's a cardiovascular disease associated with it, pulmonary disease, they will all worsen the outcome. Vis-a-vis the risk of COVID-19 in a healthy young person with no comorbidity or whatever it is, well controlled, will suffer much less. The case fatality rate, which in epidemiological, statistical terms is the proportion of death from a certain disease compared to the total number of people diagnosed with the disease for a certain period of time. This shows clearly that people with diabetes, they have 7.3% CFR, that's case fatality rate, vis-a-vis the normal or the standard 5.3 case fatality rate that is seen all across the globe. Now, this 7.3 has now gone up to somewhere around 10.5. So every day the numbers are changing. But whatever it is, it seems from the general population, people with diabetes have a twofold risk of getting worse and, of course, dying. This is case fatality. So this is dying. I would like to tell you that diabetes will just prolong the phase of the severe disease and also delay the recovery of COVID-19, independent of the virus titer. So it's the innate, inbuilt immunity system which has gone for a toss. People will experience more severe symptoms and more complications. That's what has happened so far. If you get sick, don't, with any cough and cold, don't panic. Think that it could be also an ILI, the influenza-like illness, unless it's a SARI or severe acute respiratory illness. Usually sepsis and septic shock are serious complications with COVID-19, which is seen more in people with diabetes, especially if they land up with almost near decay problems. So keep checking your sugar. If it's type 1, and the sugar is more than 240 milligram per deciliter twice in a row, in a span of 2 hours or 4 hours, definitely get a ketone done, and rush him or her to the hospital. You must always remember that the variable glycemic control, where the spikes and nadis, the ups and downs are more, it augurs more complications. If the patient has a poor glycemic legacy, the patient has diabetes for a long time and uncontrolled. If the patient has associated burden of end organ damage like microvascular, macrovascular, patient has a heart attack, has a kidney failure and other problems, then that group of patients, all of them will have impaired and altered immunity, which will actually contribute to poor clinical outcome. So remember, frequent blood sugar monitoring is a self-monitoring. We'll keep a check on that. And we need to actually refill our sources and resources well at home during this time of lockdown. We need to have extra supply of medications. There's no harm hoarding it. And the American Association of Clinical Endocrinology and other guidelines in the UK, elsewhere, they are also asking people to hoard for 30 days supply, if not 90 days, the refills. And if you do not have a backup plan, if you cannot go out of home, and if you are not getting things easily, then, like continuous glucose monitoring, the Freestyle Libre, whether you have the Medtronic CGM, if you're regularly using a pump with a real time sensor, then these availabilities are poor. Then we have our organization called Diabetes Awareness in Due Day, which is actually serving at the doorstep of people who need it, need the supply, and cannot afford to have the regular supply day in and day out, and day and night we are working. So please don't hesitate. We have our website number, www.day.org.in. So give us a call and we'll be there to help you. Mind you, there are things that we need to discuss during these times of uncertainty. We need to make difference in the lives of our patients by being calm, knowledgeable, and also responsive to changing circumstances. We need to understand that that frequent hand washing, soap and water, alcohol, etc., standing 6 feet or whatever, 27 feet. I'm not going to debate. The MIT new research says 27 feet, but don't worry, 6 feet is good enough. And taking good care of your health, contacting your healthcare provider. Don't touch post-zoo animal thing, getting positive. Don't go to the live market and touch the unprotected live animals and the surfaces of these animals. The consumption is raw and undercooked meat should be avoided. And the WHO gives us public statement that given the current spread of the virus and the pace and the complexity of international travel, the number of cases and deaths will likely to continue to climb. We should not panic, even though we are dealing with a very, very serious and novel pathogen. We need to compose ourselves collectively with a safe distance, of course, and then we'll find an answer. I have some specific measures for people with diabetes. Please do a regular monitoring, frequent monitoring, so adequate strips at home, and that will actually lessen the chances of superadded infection. If you have coexisting cardiac and renal problems, please stabilize those status. Attention to nutrition and adequate protein intake should be must hit this time. So, have your food supply adequate at home. Deficiency of minerals and vitamins should be taken care of. So enough of vitamin C and zinc during this time. Exercise improves immunity. So good walk in your closed space, in your ambient space that the right people that you're living with, and of course you can go to the terrace and do a little bit of weight training. Some water-filled bottles you can pump and exercise. You can do some bench press. You can do some pranayam, some lung opening exercises. And of course, this is the best time when you can actually seek the help of a healthcare provider nearby to get your influenza and pneumonia vaccinations if you're not done by now, which we do mandatorily for every patient with diabetes in our clinic. And finally, we have to take measures with people who have got COVID with the diabetes. We need to protect them, isolate them for 14-21 days till the symptoms resolve. We need to notify the health authorities, keep a check and alarm on these patients for a quick transfer if required to a better center, proper hydration, paracetamol, steam inhalation, antibiotics. This is the time when sugars might go haywire, so right dosing, seeing the glucometer, and of course the correctional bolus at every meal is important. The drug adjustment for other comorbidities as well. Mind you, the hospitalized patients should be brought out of metformin and SGLT2 inhibitors during this time, and of course insulin and what else could be the preferred treatment for hyperglycemia in hospitalized sick patients. Last but not the least, it's a very important statement passed just about more than a week back by ISPAD, the International Society for Pediatric and Adolescent Diabetes, that children, adolescents, and young adults less than 25 years with diabetes, naturally, with COVID-19 did not require hospitalization. Though these are anecdotal, yet this is quite reassuring at the dismal hour. But what is very important is that these patients, if they have problems in diabetes management, if they're having decay, they're actually not seeking urgent hospital care. They're delaying hospital admissions, and people are dying from decay or diabetic ketoacidosis. And multiple number of cases have happened, and we must now keep in mind that ISPAD has emphasized the importance of continued attentiveness to standard diabetes care to avoid the need for hospitalization and emergency or urgent care visits, but to utilize these resources if needed under the strapline, keep calm and mind your diabetes care. Always remember the sick day rules for the people with diabetes. So please think about them and be at their side, help them, and we are all there from Diabetes Awareness in You to be with you. Thank you.